higher morbidity and mortality rates attributes to the nurses shortage during COVID-19 pandemic in Davao City. So, in summary of the rationale, due to the shortage of nurses, the chances of mortality rates is increased. In hospital, nurses experience nurses burns out because of the high patient ratio is greater than the nurses ratio. So that is why there are failure to rescue rates in hospital because of the lackness of healthcare provider in some hospital hospital here in Davao City. The objective of this study in general is to determine the sequel of the shortage of the nurses in Davao City Hospital. So here we could talk here the effect of the shortage of nurses in patient care as well as in the hospital. So in specific, objective is to determine how does they deal the shortage of nurses currently in COVID-19 pandemic. So pandemic. So since it's pandemic, there are possible high patient ratio plus shortage of nurses had a huge impact in the patient care. So it means not all patients are catered or assisted by the hospital because of the lack of healthcare provider. Not just the healthcare provider is they had a shortage, but also the facilities. And in specific objective, we could know how they deal in the particular problem like the shortage of nurses, the high patient ratio compared to the nurses ratio, if they are still give the proper manner of care to their patient because of this particular problem. An interior theoretical framework, we have here the theory of Jane Watson, the theory of human care, Joan Duffy, the quality care model. So these are the kind of theory on nurses provide the package care to their patients. And even though they experience a particular problem, they still give the proper manner of care to their patient. And the theory of Hildegard Piplau, the international relationship theory, is the relationship between the patients and the healthcare provider. So the patient give the adequate information that the healthcare provider need to know so that the healthcare provider assure to the patient that the quality care they could give to their patient. So it's just like between give and take between the patient and the nurses. The impact of new normal learning during COVID-19 pandemic in Davos in online classes. So this is all about the psychological problem with our fellow college students since the quarantine starts, the pandemic boom for a sudden, a lot is changing. So the adaptation of new normal is not that easy as what we think since we learn from e-learning and or internet learning. The anxieties arises because of the loneliness, the eager of the people to go outside to roam around whenever they want, and especially the eagerness of the students to be in school to chit chat with classmates rather than sitting for how many hours and learning from internet via Zoom or Gmeet. So just like that. So since the objective of this study in general is to determine the psychological effect of the COVID-19 to our fellow students. So what is the effect on the student on this quarantine, the psychological effect of the quarantine to our fellow student, and specific to determine the new normal learning affects the mentality of the students. So how does it affect to our students? In psychological, in theoretical framework, we have the theory of Sigmund Freud and also the modeling and role modeling. So here's the we had emphasizes the importance of unconscious mind, as well as in modeling and role modeling is the application of the mind, body, spiritual approaches to the client care. So we had control over to our um, mental mental or psychological health, emotional, and also to our physical health. But sometimes because of the overload emotions, it explode, and we can't um, we can't I will no longer control to that emotion. So that's the time that we need a help from the other people, a helper from the other to help us how to control to that kind of emotion. So that's the time the goal of this theory is to make unconscious to conscious mind, and also to the modeling and role modeling approaches that the healthcare provider need to know the deep emotions of the client so that they can um, assist well how to help that kind of patients.
The impact of COVID-19 outbreak to mental health of frontline nurses in SPMC. Mental health is vital at all stages of life, including childhood, adolescence, and maturity. Since COVID-19 has spread over the world, every day there are reports of deaths. Some are frontliners. Nurses cannot avoid having their mental health damaged by the fear of becoming the victim. So the general objective of this is to determine the impact of COVID-19 outbreak to mental health of frontline nurses in SPMC. The specific objective of this is to determine the prevalence of psychological distress among frontliner nurses during the COVID-19 pandemic, as well as the factors that contributed to it. The theoretical framework is interpersonal relations theory by Hildegard Peplau. Since we tackle about psychological aspect and it's related to her theory, which is the interpersonal relations theory.